So here I'm going to overview angiotensin converting enzyme inhibitor. It is cardiac medication. This medication we use to treat hypertension or heart failure. Also, they protect the kidney function in the patient with a diabetic mellitus. Cardiac medication are groups of drugs. A groups of drugs we use to reduce the blood pressure. It is depends on patient condition, their age group, their sex, their race, and also other disease with hypertension. NCLEX board asks a question: if a patient is diabetic, which is the best antihypertensive medication? It is angiotensin converting enzyme inhibitors. Why? Because SC inhibitor protect the kidney function. So first of all, let me read the drug's name. In this group, we use enalapril, lisinopril, ramipril, captopril, fosinopril, also benazepril. So drugs that end with PRIL, they are SC inhibitors. Most common drugs we use enalapril, lisinopril, captopril, or ramipril. These groups of drugs, how work, mechanism of action. The angiotensin inhibitor blocks the enzyme that convert angiotensin 1 into angiotensin 2. Angiotensin 2, a super powerful vasoconstrictor that will increase the blood pressure. So if you block to formation angiotensin 2, angiotensin 2 does not work. And we know angiotensin is a vasoconstrictor, right? Angiotensin 2 also causes the secretion of an additional blood pressure elevating hormones in the adrenal gland we called aldosterone. Angiotensin 2 inhibit the aldosterone secretion, but normally aldosterone increase the blood pressure. But when less aldosterone, blood pressure go down. So what are the effect of angiotensin inhibitor over the body or heart? They lower the blood pressure and they lower the workload in the heart. Vessels like arteries or veins will be dilated and helps our kidney to excrete sodium and water. In some medical condition, we do not use angiotensin converting enzyme inhibitor, we call contraindication. The patient with hyperkalemia or angioedema, like this picture, they are not a good ideal candidate to use angiotensin converting enzyme inhibitors. Some patients complain about the dry cough. It is important to notify healthcare provider. And also, it is important to educate our patient to avoid the potassium supplement What are the other contraindication like pregnancy or breastfeeding? So in this note, we wrote what are the common side effects. Patient sometimes complain cough, we call dry cough, or anaphylactic reaction. It is the allergic reaction, or patient develop angioedema. Like this picture, the lips are swelling, right? Inflamed. Or very bad condition, unlucky patient develop anaphylactic reaction look like this, we call Stevens-Johnson syndrome. What else? Some patient complain palpitation or orthostatic hypotension. Any medication we use for high blood pressure, they have a common side effect. They can cause reduced blood pressure, hypotension. Patient blood pressure is dropped when they change the posture from sitting to standing, or patient lying down, and when suddenly they sit up or they stand up from lying position, blood pressure suddenly drop and chance to falling, we call orthostatic hypertension. Potassium level increase, hyperkalemia developed, renal function impairment, patient develop impotency or leukocytosis. Easy and common sign symptom, GI upset like nausea, vomiting, and dry mouth. So as a healthcare provider, what we could educate our patient, or what are the nursing implication? If our patient take angiotensin converting enzyme inhibitor, it is good to monitor their blood pressure to prevent orthostatic hypotension. We could check the blood urea nitrogen and creatinine to protect their kidney function. Also, check electrolyte because ACE inhibitor can cause hyperkalemia. Potassium level increase, or WBC need to check. Patient chance to develop white blood cell go down. We call leukocytosis. White blood cell go up. Also, it is important to tell your patient to avoid non-steroidal anti-inflammatory medication. So in this note, they told easy way to remember all of the side effect. If you remember the medication, ACE inhibitor, medication is called Captopril, one of the medication name, Captopril. Captopril spelling CAPTOPRIL. So C stand for cough, A stand for anaphylactic reaction, and P stand for palpitation. T stand for taste change, O for orthostatic hypotension, and P stand for potassium increase or hyperkalemia, and R stand for renal impairment, and I stand for impotency, L stand for leukocytosis. So easy way to remember, if you remember Captopril, you can easy to remind the common side effect of angiotensin inhibitors.